Depression, a leading epidemic affecting 280 million people in the world. That's 5% of the world population. Post traumatic stress disorder, postpartum depression, complicated bereavement. These are just few of the types of depressions being diagnosed worldwide.
So, what is depression? How do you look for signs and symptoms in a loved one? A depressed individual will gradually start losing interest in his favorite activities or hobbies. Things that he or she enjoyed earlier will no longer interest them or bring any excitement.
Ever had those lazy days when you don't even feel like taking a shower or brushing your teeth? Well, people with depression have this constant struggle for days and sometimes even for months. When you talk to them, and if they do trust you and are open to sharing their feelings, they would tell you how worthless they feel and that they cannot help this feeling. They may bring up events from the past, telling you how it's their mistake and showing signs of guilt. Though these people may feel irritable easily and get frustrated easily, the feeling of them moving around the house or being restlessness may be observed.
Depression can manifest in physical symptoms as well. Yep, you heard me right. From unexplained headaches to backaches, there can be chronic fatigue and there can also be digestive issues.
Some of the physical symptoms that a depressed individual may feel are disturbed sleeping patterns. They might also feel a change in appetite or unplanned weight loss or gain. Of course, as a result, the body has got to give. Decreased energy and difficulty concentrating are just some of the few symptoms. They might even have difficulty making decisions. Last but not the least, they might want to end their own life. As we cannot expect a person without his leg to start walking flawlessly, we cannot ask people with depression to just shut it all out and act as if nothing has happened. Sadly, depression cannot be seen, but it isn't invisible. If you or someone you know experiences these symptoms for more than 2 weeks, just to let you know, depressive disorder is diagnosed according to the diagnostical and statistical manual used by psychiatrists and psychologists all over the world. Please do not self diagnose and always get help from a professional. So, what do you do when you have this feeling of loneliness hitting you, or if a loved one is going through it? And what are the possible treatments?
More and more rising awareness about depression, more and more treatments are coming about. There's always a confusion between the wish of a patient to go for counseling compared to antidepressants prescribed.
Several studies have been conducted to make a comparison. Mostly results were same, provided that your counselor is well trained, is an expert in the subject you're approaching him for, and if he gives you your undue attention. If this approach is being conducted in the primary stages, why get addicted to medicines when results can be achieved by simply talking? One such study is in the description below. This study suggests that counseling and antidepressants were equally effective for depression when treated in a primary care setting, with outcome compared at 8 weeks. However, as the human mind is complicated, each type of intervention requires different treatment. For example, an individual going through post traumatic stress disorder can benefit from behavioral cognitive therapy. A person going through symptoms of schizophrenia episode may only benefit after medicines are recommended. The basic first step is always to consult a licensed psychologist to know more about your next step. Since everyone is susceptible to depression, 5.7% of adults older than 60 years old have experienced depression in their lifetime. About 70 to 80% of women experience the baby blues. This is characterized by a feeling of sadness, negative feelings, or mood swings after childbirth. This survey was conducted by American Pregnancy Association in 2015. We'll discuss more about this topic in the coming week's videos. It is important to keep a health check on your mind like a routine counseling session. Some good tips to help you with depression. Since all are unique individuals, understanding what specifically triggers up your depression is important. A good tip for someone diagnosed with depression is to keep a diary for 30 days. A daily log can help you check what habits or activities you did on the days you fell down, so to avoid these activities in the future, and vice versa, what made you feel better. It is always important to talk to someone, anyone you trust. It could be a friend, a colleague, or your parents, where you don't feel judged and where you can let it all out. crying has been proven to provide cognitive benefits. According to a study conducted by Harvard University, emotional tears have advantages on mental health. Researchers discovered that sobbing causes the production of oxytocin and endogenous opioids, often known as endorphins. These feel good hormones aid in the relief of both physical and mental pain, sometimes even experiencing physical pleasure. Self soothing via crying has the power to control emotion and promote calmness. You must also check if the depression is due to any medicines you have been taking or chemical imbalances caused by nutrients, supplements, or even recent environmental changes. Though cognitive behavioral therapy has been ruled as most effective, you may want to check if help from medicines is needed to balance your chemicals. A walk for 30 minutes a day can actually help keep depression at bay. Exercise can help the mind and body to connect. More effective and less reactive medicines like selective serotonin reuptake inhibitors can help as well. Relaxation techniques play a vital role. Don't underestimate your connection with nature. Hearing a bird or watching trees could assist in easing your depression. Always eat healthy foods and avoid alcohol, and also avoid processed foods. Get enough sleep and follow a regular routine. More information on food that helps with depression will be following in the next video.